So, dear colleagues, welcome to this press conference to go over the situation in Quebec about COVID-19. The Premier of Quebec, Mr. François Legault, is today with the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier, yes, first, the mask that I'm wearing today was made by Jane Gray from the Mi'kmaq community. I would like to start with the overview of the day. You have the numbers. We can see that the situation is improving and has been for a few weeks, particularly in the community. But it remains, and I do wish to say it, there is still a situation that is still difficult in long-term care residences. We still have 278 residences, CHSLDs, RPAs, and RTIs that are infected. 1,126 residents that are still infected, so the work is still difficult in CHSLDs. And I'd like to remind you that we want to add 10,000 new orderlies in CHSLDs. There are courses, so training, that will start Monday next, the 15th of June until the 15th of September. So until the 15th of September, things will remain difficult, and we need the people who are there, including the soldiers. And I'd like to come back to the situation of the soldiers, because for a few weeks, we've had a significant drop in the number of soldiers present in our CHSLDs. The 21st of May, we had 1,320 soldiers. Today, we have 400 in CHSLDs and 350 who do supervision work outside of CHSLDs. So there are three things that we would wish, and I remind Mr. Trudeau of this every day. First, we'd like to keep those soldiers until the 15th of September. Second, we would like there to be more supervisors who actually help out in CHSLDs, because what we need more than anything are hands in CHSLDs. So I still don't get the ratio of having 400 soldiers in CHSLDs and 350 who are supervising those 400. And we would like to go back up to at least 1,000 soldiers. So, as I said, we went up to a few weeks ago, we're at 1,320 soldiers. We've always asked to have at least 1,000 since the beginning, and we need those soldiers until the 15th of September, until the training of the new orderlies be completed. So, we still have surveillance in CHSLDs and residences. In the community, however, things are going better, and it would seem for the time being that there haven't been too many impacts from the confinement measures in community transmissions. So we can really concentrate on our second largest issue, which is the economy. Kickstart the economy. First, there are many businesses encountering difficulties. We set up a special fund of $2.6 billion at Investissement Québec, $250 million now in the funds for investments. So there's thousands of businesses that we have already helped. You saw this week that we improved our program in order to be able to reimburse rents and leases, or part of them, 72.5%, together with the federal government. So we are the provincial government that does the most. In other provinces, it's 50%. Here, it's 62.5%. You saw that this helps mainly businesses and restaurants, and understand that many businesses and restaurants had to pay a lease for those 3 months where they had no clients. I'd like to remind you that we announced $400 million in culture, and this afternoon the tourism minister will be announcing a $750 million plan in tourism. Of course, the hotels are empty, and what we would wish is that people travel in Quebec, and that we encourage in all regions of Quebec, that we encouraged tourism. Of course, we're trying to help as much as possible So all businesses of the private sector, we'd like for them to rehire the employees that they had before the crisis. But at the same time, we have to be realistic. I'd like to, for example, mention in the case of hotels, if we take, foreign tourism, it is clear that they won't be able to count on those tourists for a good while yet. So we have to compensate for those jobs. And all economists agree to say that when the private sector is not there, well, it's up to the public sector, that is the government, to do more. And I'd like to get back to the bill on infrastructures. You know, in Quebec, the process, the delays to be able to do infrastructure work are much too lengthy, longer than elsewhere. That's true for schools, it's true for CHSLDs, it's true for hospitals, it's true for roads, it's true for metro stations, for example, the Blue Line. So I would like to just give you one example. The CHSLDs, on average, when you look at it, it takes 4 years to be able to finalize the construction of a single CHSLD. So there's also just steps to go through from the expropriation, to go through the urban planning and the environmental evaluations. Even before the pandemic, and it's important to say that, we worked on mechanisms to change the rules, to be able to go faster, because I think that it is possible. It's not like we're more stupid than others in the world. Quebecers can build a CHSLD in 2 years, say. There is no period for it to take 4 years, and that, hospitals and roads take 15 or 20 years. So we were already working on mechanisms to fill our promises, because the CAC did make promises during the electoral campaign. Let's think about the schools and CHSLDs and a certain number of hospital, road, and public transportation projects. There's an additional argument that has been added, and it is the fact that the pandemic makes it that right now there are construction workers who usually work on private sector projects who are home right now. So we know with the temperature in Quebec, the construction season outside is pretty limited. The summer doesn't last 12 months in Quebec. So if we miss the boat on the summer 2020 or 2021, when we miss an entire season, that means that we have to go to the following summer. So that is why we chose to table a bill quickly and to work on it together with the opposition. So to be able to do whatever was necessary to reassure everybody, particularly on the environmental front and on the correct management of things. So our objective, when we tabled this bill quickly, Bill 61, was to be able to not lose out on the summer 2020 season, and to also be ready that projects also be ready for the summer of 2021 and 2022. And I think that we've shown our good faith. We've brought a lot of amendments and modifications contrary to what, or following what was said by the opposition parties. But regardless of the pandemic, if this bill is not adopted in the spring, we're going to come back to it in the fall. And I just want to bring one clarification. The reason why we said that we don't want it to be adopted under a gag rule, it's not because we can't. It's because we don't wish for that. What we want to do is to work together with the opposition. We're very conscious of the fact that we're asking them to work very quickly, but we wish to do it for the well-being of Quebecers. I would even add our promise, for example, of building homes for the elderly during the 4-year mandate. We have 2.5 years left. Even before the crisis, people, public servants, people responsible for those files were telling me, Mr. Legault, it's going to be really hard to build all the homes for the elderly that you wish to have by the fall 2022. So once again, this is not a new problem, but it seems to me that with what we've just experienced for the past 3 months, It seems to me that our elderly deserve that we accelerate the building of homes for the elderly. There's no reason, it makes no sense that it will take 4 years to build a CHSLD or a home for the elderly. And just so that everyone understands the mechanism as well, it is very important that we agree by tomorrow on the principle. So what we're asking for the opposition is not to agree on every single article. It is to agree on the principle, and the principle is to reduce the delays for infrastructure projects. Once we'll have agreed on that principle, we will be able to, as of next week, go into parliamentary commission, study article by article, and once again, we're very open to the suggestions. We are ready to make compromises. We don't want for the bill to be useless either, so we do agree to make compromises, but we want to be able to do this work within the next 2 years. And so what I'm asking all three opposition parties is to collaborate. I think that we've had very good collaboration in the past 3 months with the three opposition parties, and I think that this is what Quebecers wish. I would like to repeat it. The construction season outside is very limited, and I would find it sad to lose summer 2020 and to not have enough projects ready for the summer of 2021 and 2022. And I would find it also sad that construction workers who are on unemployment right now at home because projects from the private sector have been canceled, can't go back to work on public infrastructure projects. So I would invite all three opposition parties to work together at relaunching the economy. And there's another point that was raised by the opposition, by certain analysts. We have experienced in Quebec a very somber period, which is the entire period of corruption and collusion in the construction world. I think that there isn't a single Quebecer who wishes for that to come back. So there's no question of not taking every single good management measure to make sure that there will be no corruption, no collusion. But once again, I cannot believe that Quebecers aren't able to build a CHSLD or home for the elderly in less than 4 years while respecting the environmental requirements and while respecting the good management practices. It's almost like saying, I don't accept that we'll have to say, well, we have no choice. To be able to follow all the rules, we need 4 years, we need 7 years to be able to create a project. No, I don't accept that. And I am ready, as we like to say in the political world, I'm ready to take the heat for it. I feel that I got given a mandate by the Quebec people, yes, to respect the environment and yes, to respect good management practices, but also to give to Quebecers finally the schools, hospitals, CHSLDs, roads and metros that we have been waiting for way too many years. So we must work together. Let's work together. All four parties at the National Assembly. That is what Quebecers wish.
Good afternoon. Our daily numbers on the pandemic continue to show that we're going in the right direction. We're working also very hard on restarting the economy. One of the best ways to do that is accelerating important infrastructure projects. We're talking about schools, hospitals, senior homes, roads, and public transports. Those projects won't only benefit Quebecers in every region, but they will also put people back to work. And accelerate those kind of projects without harming our environment or facilitating the corruption. So that's the goal, the principle of Bill 61, and we would like to know if the three party of opposition, if they agree or not on the principle. We have until tomorrow to know that, and then work to have a better project. So we've heard the concerns from the opposition parties, and we ensure some of that this morning with important modification to the Bill 61. Now it's time to put partisanship aside and work together to restart our economy for the benefit of all Quebecers. Thank you.
Merci à vous, Monsieur le Premier ministre. Alors,
Thank you, Mr. Premier. We will now be starting with the French question period. Hello, I would like to come back to the question of the military personnel in CHSLDs because officially the mission is over tomorrow. The Trudeau government said that he would not let Quebec down, but what is the problem right now? Is it a question of money? I don't think that it's a question of money. As I was saying, there are three problems. The first one, we are now down to only 400 soldiers in CHSLDs. Another problem is why is there a need for 350 supervisors for 400 soldiers in CHSLDs? And there's also the question of the date, yes. I believe that we went as quickly as we could on the training. We can't go below 3 months. It starts on Monday. Everybody is working night and day to do the interviews and to choose the best candidates, but now we need 1,000 soldiers in CHSLDs. I still haven't had an answer to know, what can possibly be more urgent in Canada or elsewhere than caring for our elderly in CHSLDs. Dr. Arruda, there are health professionals who spoke this morning wearing mandatory masks in closed public spaces or where there's a lot of people, especially with the possibility of a second wave. Are you of the opinion that we should be going towards that? Well, I think that it shouldn't be excluded. But right now, we are going to be looking at the literature, and these are expert opinions for whom we have respect. We very strongly recommend a face covering. That we've said we want that to become a social standard so that people take the habit of wearing it. As far as making it mandatory right now, I'm going to wait on what the different international and Canadian and Quebec authorities say, our experts who are looking at the cons and the pros. Certain studies show the efficacy. Some people are criticizing those studies, but what is very important is that we do strongly recommend the face covering, but don't forget distancing and hand washing. So I don't want to exclude that it might be the case in a second wave if we have enough data or that international authorities go down that road.
Monsieur
Legault, we heard you this morning during the question period, and you said it is excluded to have this adopted under gag rule this spring. But for the summer, as of the 22nd, 24th of June, might you have recourse to that? No, what we're saying is we'll come back in the fall with a bill. We need that bill. I feel that I have the responsibility and even the mandate. I think that the CAQ has always been seen as a party that wishes to improve the efficacy of the state, and it makes no sense that that we require 4 years to create a CHSLD or a home for the elderly. In order to do that, we had to change the rules, we have to change the delays, and we need a bill. And if the opposition does not wish to collaborate this spring, well, we'll come back in the fall, and then nothing would be excluded. You also evoked, both of you, that there might be a lack of respect of guidelines, perhaps a certain slackening lately. Are you still able to see that this continues, or have people come back to respecting the distance and wearing masks? I am not everywhere to be able to see. Certain people tell me that there's a certain slackening. I can tell you that with the climate, that is beautiful, and the impression that, there's fewer hospitalized cases and everything. Of course, people might forget an element. I think that we had to come back to a certain normality, but a transformed normality. In the same way that businesses and malls and stores and restaurants will be reopening differently, I think that we also have to, out of respect for others and for the health workers who were affected, and also out of respect for those who have died, to try to follow the guidelines. I would say that, in fact, trying to maintain the 2 meters, we've allowed for certain openings, 10 people, 3 households, 2-meter distance. We are trying to respect that, even with the idea of vacation that's coming. and the possible moving around. We're lucky that the transmission indexes in Quebec are lowering, but that doesn't mean that the virus is absent. I think that we have to come back towards a certain life normality because physical health is very important, but mental health is also. We know that taking a vacation is important for people's mental health, but let's be prudent. If everybody puts in the effort, I mean, there will be cases, but there will be less impact on society. So I think that we have to repeat it and repeat it and repeat it. You can also repeat it to others if you see behaviors, that are questionable, nicely. Avoid people, that are too close together, people who come from too many households. We still want to recommend that. But we want to come back to a life balance. So we'll be talking about it this afternoon as far as moving around between the provinces or between regions is concerned. I think that at this stage, if you have symptoms, don't go out, you don't expose elderly people, you keep the distance. And even if you are outside of your residence, if you're elsewhere, you do the 10-3-2. 10 people, 3 households, 2 meters. So keep going with the guidelines. I mean, if we go back, Dr. Arruda's not going to be happy, and we'll be forced to close back things up that have been open, and we don't want to have to do that. Speaking of a second wave, is an equivalent second wave, will it lead to an equivalent confinement? Well, listen, we're looking at all sorts of scenarios. We're trying to see how things are happening elsewhere in the world. I think that going back to a total confinement, as we did, is probably not something that would be done. We've learned more about the virus. We've learned more about what happens, for example, with children, so that's all good news. We had closed down sectors of activity in Quebec that never got closed elsewhere. So I think that what will be most essential will probably remaining open. But what we would call a certain party, or important gatherings or things like that, I think it won't be the case as such. But it's difficult for me to tell you exactly what it will mean. It would also probably depend on a regional variation, and it's also possible that rather than doing all of Quebec, depending on how it can evolve, from one region to the other, there can be what we call localized confinement. It will depend on many elements. But to date, I don't think that if we reconfine, it would be like a total stage. And also because of the perverse effects of confinement, you've seen some of them. If we confine every year, the impact that it might have on people's mental health could be present. So as I was saying, we'll see. But for me, it won't be, and we'll probably have drawn lessons in terms of elements for our healthcare system, particularly for CHSLDs. That's why we're preparing ourselves with staff, and we're going to put teams up to not experience the same thing. But it can't be too important transmission in the community either, which we did not experience because we had good confinement. So once again, it'll be about reaching balance. Yesterday, I believe, the former president of Saint-Hubert, I'm sure that you've seen, wrote a letter according to which he says that for restaurants, 2 meters is too much. We talked about it Tuesday, 1 meter, 1.5 meters, 1 meter and 3/4, 2 meters. For restaurants or certain closed inside spaces, would it still be possible, do you think, with other extra guidelines to reduce that, to allow them financially to survive? Yeah, you asked me the question the other day, and I'm going to tell you about the same thing. We've reopened things with a 2-meter distance, and we'll see what comes of it. And also, depending on the data that we get from elsewhere, there are countries where they are at 1 meter, some other are talking about 1.5 meters, and others that say that it has to be 2. There will be a judgment and a balance that is going to be done and all that. I am not excluding that it could decrease, but I'm not giving any guarantees or any specific date. So let's see how things happen. I know it's hard. I'm very conscious of that. But we can't go forward to have to go back after. So we have to, take little steps. Like go forward like a turtle for some, or like a hare, depending on the situation. There seems to be a few tensions right now with the federal government. You talked about the army. The $14 billion for CHSLDs as well. That was the Prime Minister just said no to that, who says we're not going to give, a blank check to the provinces. What do you say to that today? Well, first of all, Monsieur Laforêt, I would take advantage to say that I saw the video of your two little girls. Everybody should see that 1-year-old twins who learned how to cough in their elbows a lot better than I do. Yeah, not in their hands. Yeah, not in their hands like I do sometimes. But as you know, every Thursday evening we have a telephone meeting, all the premiers and the Prime Minister. He announced to us last week that he wanted to transfer $14 billion to the provinces. So that represents more or less, depending on the way that the amount is broken down, $3 or $4 billion for Quebec. Pretty much all the premiers said it's important that there not be conditions attached to this amount. A lot of things worry me in that. Amongst others, all the PPE material and everything having to do with screening. And what's the word in French of tracing? Contact tracing in French? I feel that the federal government is ready to pay, but wants to have a certain control over it. For us, it's quite clear. Health is up to the provinces. There is no question that we give in. The entire control of the screening strategy, as well as procurement in individual protective equipment. If the federal government makes itself a reserve that could help out the provinces, that is one thing. But that they want to get mixed up in it and that it's part of the $3 or $4 billion that we receive, well, that leads to a problem. Just to give you an idea as to the scope, in Quebec, we're already at over $3 billion in additional expenses in health and another $3 billion in the economy. And of course, as well, there will be amounts that will be recurrent. When we say that we're going to be adding 10,000 people in CHSLDs, well, that's a $500 million amount per year. And the other thing that we're asking together all the premiers of all the provinces is that the amount be recurrent so that we can go through health transfers of the provinces in order to do so. The other worry that we have is concerning the municipalities. We know that the federal government wants to go over the provinces to go work with the municipalities and give certain amounts that would perhaps be just for public transportation, for example. Whereas depending on the size of the municipalities, yes, and we must, both governments, we must help the larger cities for the losses that have been incurred in public transportation. But that is not the only expense of municipalities that was caused by the COVID-19 situation. So we would like, once again, to have flexibility with these amounts. So we've talked about it. We will be talking about it this evening. But I won't keep it from you that I do have certain concerns. There's a lot of pressure. Now you are deconfining. There's almost no one left who is confined. There's almost no sectors that are not yet open. There's the bars open, the gyms, and places of worship. There are some people that are getting very impatient. Mr. Ruda? Well, we understand very well the impatience of all those who are not yet deconfined. But we have to, keep in mind what will be announced about this element of reopening, I would say, but with conditions that are particularly for places of worship that are going to be avoiding, they had to avoid, large inside gatherings. What I can say is that it's coming soon.
Bonjour à vous deux.
Hello. There's a lot of facts about the masks. Toronto today is making them mandatory. There are experts that have come out and said so. And in Quebec, we can see a certain slackening in the wearing of the masks. There's even like the NSPQ talked about that effect of the lemming. People see that others don't wear masks, so they don't want to put it on because they feel that they're being judged. Why not make it mandatory, since now there are enough masks available? As I said, so we're keeping an eye on the situation, scientifically speaking, but also to see what people's behavior is. Things that are mandatory, let's take the example of mandatory vaccination. We don't have it in Quebec. Other places do, and the coverage rates are not as high. So we'll see according to the evolution. We have to get there. We'll see whether the social standard will get set up or not. Anyway, our experts, the people with whom I deal with, and it's not at all a decision that is made in any other way than through thinking about it from a public health view. We'll see how we can convince people. Well, but we can see right now that it's not really working, the social standard. Well, it depends. We do have data from surveys, but yes, we have to keep a close eye on it to see how things will keep being done, and there are movements that certain cities have decided to do, and I think that there's no province that has recommended it yet, but we'll be following the situation. Why public health did not believe that it could intervene in Velpro in the Montérégie region? I'm sure that you heard of that story where there were temporary foreign workers who were infected, a third of them. Why not have intervened proactively? What lessons to draw from it? Well, listen, they intervened. I mean, I was made aware of the situation, and I did make questions. And there's probably going to be information given. But the company itself mentioned that it did not agree with the indications that was in the news. They intervened on the 29th of May. As of the next day, from the declaration of the first case, they're in active intervention. What did not take place is that they didn't go there to test on the premises since the bus was not available. So they offered another alternative, and I think that I would tell you that the company, as well as public health, are in very intense close link, and they are controlling the situation. So I don't know if the Director of Public Health emitted any communications on that, but the facts will get rectified. The cases were taken charge of and or have been taken charge of right now. Monsieur Legault, you saw the revelations of the Investigation Bureau this morning about André Boisclair. Your government has announced administrative verifications, but you want to shed light on the behavior of Mr. Boisclair at the time that he worked in New York, and what could look like an attempt to have hidden the information from the government at the time. As Nadine Giraud said this morning, we asked to make the verifications on what that information was that the government at the time had. So we are making those verifications as we speak. And they have to do with what exactly? Well, on what information was available and what decisions were made. What information was made public, what information was not made public, etc. And on having to do with the gag rule, you say that you want to have the bill in the fall. So in the fall, there might be the same impasse. Why not use the gag rule right away and to avoid losing the summer of 2020, as you said earlier on? I think that the bill is a bill, as I was saying, that we would have tabled anyway. Now we've tabled it, and we'll all agree, not with regular timelines to be adopted. So I believe that we have to give people the opportunity, and we wish that the opposition will work together with us to improve the bill, modify it, and that everybody be comfortable, since it is a very important bill, and that there are concerns that are legitimate. So, of course, in the fall, we'll have more time to explain it. And we'll be able to have a different approach. But taking into account the very short delay for its adoption, we want to adopt it with the approval of all three opposition parties. Mr. Premier, are you ready to leave $3 or $4 billion in Ottawa for a question of respecting, what's up to each provinces? And how is sending an example of your screening equipment and the way that you're doing it, how is that unacceptable? Well, if it's just to send a copy of our screening strategy, there won't be any problems. But it is important to respect what is up to the provinces. We know that there's money, but it's an important amount for social housing, for example, that has been sleeping for years in Ottawa, because all governments, including the federal government, did not accept making any compromises and to leave the provinces with what they are responsible for. So I think that it is important to respect our economy. This is provincial jurisdiction, but we do want the 3 or 4 billion. The former minister, the former head of the Parti québécois, André Boisclair, is very serious. According to the information they have right now, was the Quebec state noticed or told by anything inappropriate when he was high public servant in New York? Are you going to reveal any agreement between him and the government? And also, why were you told ahead of time, 2 weeks ago, I believe, that he would be facing the justice? I don't know who, maybe somebody in the government was told, but I was not told. And I have no more information than what I read in the newspaper this morning. So we are going to check things over, and we'll see what it is possible to make public, but I want us to be transparent totally in that file.
Bonjour. D'abord, une question sur...
A question on Toronto. You've talked about Toronto before. I even believe that you had identified this North American exception of Toronto. And despite that situation, I think that you have to doubt on the real situation of COVID-19 in Toronto, but it still so happens that Toronto has decided to make the wearing of the mask mandatory in public transportation. Why is that not being done here? Well, listen, I follow the recommendation of public health. Public health has not been recommending making it mandatory. What I understand is that making it mandatory means that there will be penalties, that there would be fines, police officers who would check all that. So we made the choice of saying we strongly suggest it, but we're not making it mandatory. It is a choice being proposed by public health, and I support it. On the lack of staff, what guarantee do you have that you will, in fact, have 10,000 people, that will be doing that training as of Monday? What guarantee do you have that all the interviews and the study of, the level of preparation, what guarantee do you have about that to be able to do that work? One point of clarification. There's the entire question of service helpers, people who work in the private sector. We are, of course, looking at what the impacts would be of putting all those people in training for 3 months from the 15th of June to September. So it's not impossible that a certain number of the people will follow training in a second time frame to not hurt the operations of the following 3 months. But in total, I trust we had over 80,000 people who applied. There's 34,000 of those who, when we made them fill a questionnaire that made sure that they would be ready, for example, to work at night, who said yes. So out of those 34,000, we do want 10,000, and it is not impossible that a part of those 10,000, it will be done in a second time frame in order not to hurt services to the elderly over the next 3 months. Thank you. This completes 4 questions in French.
In English, we start today with Phil Gauthier, Montreal Gazette.
It's an honor to start. An honor to start.
My pleasure.
I have a question. A good day to you all. A short question for Dr. Arruda. You have talked about wanting to hit 20,000 tests a day. I think you even spoke of 30,000 at one point. We were looking at the numbers, and you haven't hit 14,000 since May 28th, and 14,000 was the other goal. Can you tell us why so few people are being tested as we deconfined, and what does that mean?
That's a good question, and I think my Prime Minister, the Premier, is gonna ask me every day that question. In fact, there is less cases and there is less testing in I would say in the care system actually, but we are, and also there is even if we had some buses going in Montreal in different places, people were not at the rendezvous, and actually we are reevaluating the way we're going to offer the test, reevaluating also the asymptomatic people who are going to be checked in different settings, especially the ones that we open again. So I'm happy that there is less need for cases. That's okay, but I'm not so happy to see. And at the same time, when the transmission is low, testing is not always an easy way to think, because there is could be some false positive, false negatives. But at the same time, we didn't reach the only 14 one day in May. And now we are seeing that going down, and so we have to readjust and to perhaps more promotion on the strategy.
Second question.
Second question is for the Premier on Bill 61, your favorite subject. In Bill 61, there is money for the expansion of Dawson College.
Yeah.
And this morning, the PQ was saying they want that project removed from Bill 61 because they don't want to give money to Dawson, and they think the money should go to Francophone cégeps. What is your response to that?
My response is that Dawson College is appreciated as a college. I know that some Francophones are going to Dawson, and putting money to extend the capacity of Dawson doesn't mean that we refuse other projects on the Francophone, in the Francophone colleges. And we have no intention changing the Bill 101. That doesn't apply to colleges. So I support the extension, the expansion of the Dawson College.
Thank you. So now two questions for Global News from Raquel Fletcher. Ottawa has agreed to help in long-term care homes until the fall, but you say you're not getting all the support you need from the federal government.
About the soldiers, eh?
Mm-hmm.
On May the 21, we had 1,320 soldiers in Quebec in our long-term care facilities. Today, we have 400 in our long-term care facilities and 350 doing some supervision. And we don't have any guarantee that even those one will be able to keep them until September 15. So I would like to have at least 1,000 that they be working in the long-term care facilities and that they be here until September 15. I think that we're working very, very, very hard to train additional people to be ready for September 15. But in the meantime, we need this support.
Thank you. And as a second question, we are hearing that there could be accommodation for asylum seekers that are working in healthcare. Is this the case, and will it be extended to other asylum seekers working in essential services?
Okay. We didn't have any discussion with the federal government. We've asked them for that. I've seen that there was some information in some newspapers about the opening of the federal government to accept those asylum seekers. But still, Simon Jolin Barrette is asking the federal government that we work together to accept as immigrants the people that are working in long-term care facilities and that were asylum seekers.
En français, s'il vous plaît. Pourriez-vous répéter?
Oui. Ben, écoutez, j'ai vu.
Well, listen, I saw, as you did in the media, that the federal government was open to accepting as immigrants refugees. Even as far what the article was saying, we were talking even more than CHSLDs. But when speaking with the federal government, we did not get that information. So the request that we were making is that those refugees who worked in CHSLDs, that we be able to find a way of accepting them as immigrants.
Merci. So back in English, Samuel Pouliot, CTV News.
Hi. Is it a good idea that Air Transat starts flying again in late July? And will people who go to Europe with Air Transat, when they come back, will they be in quarantine?
That's a question for Dr. Arruda. Of course, Air Transat or Air Canada, there are many questions to be asked. First, you have to talk about domestic flights. Second, you have to talk about flights between Canada and the United States. And then you have to talk about flights between Canada and other countries. At this time, it's not open. So maybe we'll get the okay from Dr. Arruda in the next few weeks, but so far we don't have, it's not open.
And that could be variant depending on the country you have been, depending on the epidemiology there. So I think we are looking at this, but it's not. There is no decision taken right now.
Okay.
Second question.
And, there's a group of doctors that is asking the province to make face mask mandatory. Is this something that Quebec will do?
In fact, what I can say, it's not the case right now. We are recommending it, really high recommendation. We would like people to use it as a social norm, as the same way we did the etiquette respiratoire. But we cannot exclude that situation, but that's not the case actually. We will see what is going to, our experts will recommend us. We will see also what other authorities in the international, Canadian, or even in Quebec are recommending.
Next question, Cathy Sonnet, CBC News.
Good afternoon. An analysis by CBC showed that Black Montrealers specifically were hardest hit by COVID-19. When will the province start collecting race-based data? And with that, might this help to address systemic problems in the province?
I think that the issue of collecting information about race is always a sensitive one because of different effects of discrimination. But I think there's going to be probably some studies done specifically on those populations to understand what are the factors that makes them having more the disease. Is it only because they live in a more, I would say, condensed population in urban settings? Is there any genetic relation between, because we know that some genetics can have an effect on different surviving? Is this because of cofactors of other diseases, chronic disease? That could be done by a study, I would say, but not necessarily connected right now. And doing a study, specific study, is sometimes you can get more information than if you only collect data and make some extension, because the data is only surveillance data that you are not access necessarily to the charts and everything. So that is going to be done. It's going to be probably done here in Quebec and elsewhere, I would say, in the world.
And if I can ask you about this farm in the Montérégie region that was hit by an outbreak, and then you said that, well, there was a confusion between the CIUS and the honor, saying that public health, there was some confusion about if public health helped and how it did help. But I just would like to clarify this with you as a matter of, this is just one example, but summer is here. So what can the province can do to help farmers to protect their workers during the summer?
Okay, it's a very important issue. We know that there is already some, I would say, foreign people coming here to the farm, and there is protocols that have been prepared, especially for I would say the workers, especially for the farmers, and we're going to follow up those protocols. There is probably a need to be working also with the federal level, because when they arrive at the airport, to make sure that they will have the good information to quarantine and everything, and probably make sure that we can detect rapidly cases and not have big, I would say, eclosions of the disease. So we will have a specific attention, I would say, on those things in the next days, because actually, even in Mexico and in other countries from the south, there is an active transmission, actually. There is some issues that we're going to look at also, is that some of those workers are not paid when they are sick And so, and perhaps they could not be declaring themselves. So we're going to look at all that thing with the Ministère de l'Agriculture and make sure that we protect them and also make sure that we can keep those persons safe and have helping our industry of agriculture.
Thank you very much. Alors, c'est ce qui complète pour cette conférence de presse.
This puts an end to this press conference. Thank you very much.